Imagine a young Indian with a spinal disorder normally seen in seniors. Well, that is not too far-fetched, unfortunately. Brittle bones, osteopenia, usually seen amongst older Indians, is now being seen in the younger population. So what's really going on here? Why are younger Indians getting brittle bones? We explore.
A young person with bone loss problems. Surprised? Don't be. It is becoming extremely common nowadays to see younger Indians develop problems seen in aging populations.
Doctor, what is happening? Why is that younger people are suddenly developing osteopenia? Are you also seeing cases where younger people are coming to you with these bone problems?
In fact, in my practice, routine practice, I have seen a significant shift. 15 years back, I used to see majorly the patients who used to come to me with this problem were beyond 50 years of age. And now routinely I'm seeing patients who are coming in their 20s, 30s and even 15-year-olds. You will ask me why? So one major important thing over there is a diet. Because these days, this generation has a lot of more carbonated drinks, sodas, fizzy drinks. The balanced diet doesn't exist. We are not eating healthy food.
So what would be the classic symptoms of this? Osteoporosis and osteopenia.
One thing is very funny that this is a silent disease. So it will start impacting you, it will impact you, and overall you won't understand. So overall you start to develop vague symptoms like chronic backache, they will have some wrist pain, they will have some dull feeling overall in the body, they won't be able to perform like how they were, and they would think this is a new normal, but in fact it is not. It is silently the bones being killed.
Doctors say inadequate nutrition and lack of physical activity is a core concern area.
And what is this connection between food and bone health?
Literature has already established that if you're having carbonated drinks and sodas, that is a known risk factors for increasing the bone washout. India, it is one of the important areas wherein we have a good sunlight. But if ever you see the current trend is that people want to run away from the sunlight.
Doctor, I don't think we can't stress enough on the importance of exercise and exercise at an early stage for this, because we as a country are not exercising as much as we should, isn't it, including lifting weights?
Yes. So I agree, because lifestyle change is very much important over here, which starts from diet. Have a well-balanced diet, include things like ragi, green leafy vegetables, that will help you. Have some amount of sunlight, 20 minutes of sunlight is going to be good. But the major important thing is some exercise. So whenever there is an effect of pulling on the bones become stronger. And how do you pull the bones? It cannot be manual. So it can be by running, jogging, lifting weights. So you keep on pulling the muscles over the bones, and there is an effect wherein the bones become stronger and stronger.
So I also want to ask you, why is that women are developing these problems in India and why are they so prone?
It is established that women have naturally lesser bone density as compared to men. That is something that is given by God. But apart from that, hormonal cycle, the menstrual cycle that females have, once the menstrual cycle stops, that is counterproductive, because that is when the washout happens, because these hormones have a very critical role in safeguarding the bones over there. Apart from this, when we talk about younger girls, there are so many societies still who don't let the girls play. So over there playing, jumping around, walking around is important. Breastfeeding and pregnant women, they need good amount of calcium in their diet. If they are not replenishing their stores, they start developing deficiencies.
What kind of tests should one be doing? Can one preempt कि ये मुझे हो सकता है and do certain tests so that, as a preventive measure, so to speak?
So one important thing over there is a thing called BMD, wherein the BMD test is done and they try to diagnose you with osteoporosis and osteopenia, but that is not the test to be done. That you can just consider as a screening, not as a definitive diagnostic test. The major gold standard diagnostic test is DEXA, Dual Energy X-ray Absorptiometry. You do it from 3 sides. One is classically lumbar spine, one-sided hip and the other-sided wrist. This will give you an idea overall about the status of the body, and you can make the diagnosis and start the treatment according to that. Apart from that, FRAX score is very much important, because the people who have been diagnosed with osteopenia and osteoporosis, we have a fancy scoring system that we do. With that, we predict whether you're going to get fractures. So according to that, we can decide what exactly should be the treatment that should be given.
Who are the people who should be going for these tests? What are the risk factors in individuals who should be opting for these tests?
So, it's not like everyone should be going the test. Ideally, there are some risk factors for osteoporosis. So what are they? Women, if they are incurring heavy bleeding during their regular menstrual cycle. Women after menopause, if you are having a long-standing history of thyroid, that is hypothyroid, If you are having a long-standing history of diabetes, so these are the known risk factors. Apart from this, if men or women have any hormonal issues, long-standing or even short-standing, so bones get impacted, get the test done. And in case of males beyond the age of 70, it is important that you start doing the test every once in 2 years.